Hey everyone, it's the One Health Vet, and today I have a video on Lyme disease and how it's an illustration of the One Health concept. So to start off, let's answer the most obvious question. What is One Health? One Health is the recognition that the health of an ecosystem and all of its living components are connected both within and without. And that is to say, diseases and public health emergencies arise not from a vacuum, but from everything else with which we as humans share life. So now that we know a little bit about what the term One Health means, let's think about why this may be an important idea. The public health issues of today's world require interdisciplinary communication and cooperation. And some quick examples where this can be seen are the topic of climate change, with emerging infectious diseases, mental health, and also vector-borne diseases like Lyme disease that we'll discuss today. One example that really illustrates the necessity for this type of thinking is Lyme disease. It's a vector-borne disease with animal reservoirs, and both the vector and the animal reservoirs are affected by things like the human built environment and climate change. The Lyme disease bacterium, Borrelia burgdorferi, is spread through the bite of infected ticks. The black-legged tick, sometimes called the deer tick, whose scientific name is Ixodes scapularis, spreads the disease in the northeastern, mid-Atlantic, and also the north-central United States. Ticks can attach to any part of the human body, but they're most often found in hard-to-see areas like the groin and armpits, and also areas that are hidden by hair like the scalp. In most cases, the tick needs to be attached for 36 to 48 hours or more before the Lyme disease bacterium can be transmitted to a human. Most humans are infected through the bites of immature ticks called nymphs. And as you can see in the picture here, nymphs are very, very small and very difficult to see. They feed during the spring and summer months. Adult ticks can also transmit the Lyme disease bacteria, but they're much larger and more likely to be discovered and removed before they've had the time to transmit the bacteria. The life cycle of black-legged or deer ticks generally lasts 2 years. During this time, they go through 4 life stages, and those are eggs, which appear in the spring, larvae, which appear in the summer, nymphs, which appear in the following spring, and adults, which appear in late summer or fall. You can tell the difference between larvae and nymphs both by their season and because larvae have 6 legs and nymphs have 8. After the eggs hatch, the ticks must have a blood meal at every stage to survive, and the greatest risk for human infection is during the late spring and summer seasons. Lyme disease affects thousands of humans each year and is actually one of the top 10 notifiable diseases in the United States. There were just about 30,000 cases reported in the US in 2012, but some studies indicate this may be a vast underestimate, and the actual number of Lyme cases is probably more likely to be around 300,000 cases per year. An erythema migrans, or EM rash, appears in about 80% of cases. The rash usually appears about 7 to 14 days after the tick bite, but its appearance can range between 1 and 30 days after a bite. The rash expands over days and classically has a bullseye appearance, as you can see in the picture. But it is important to note that rashes may appear atypical as well and lack the bullseye appearance. Additional symptoms during early Lyme disease, or within 1 month after a tick bite, can include fatigue, muscle and joint pain, headaches, and fever. If untreated, the bacteria responsible for Lyme disease can disseminate through the blood and cause symptoms for days to months after a tick bite. These symptoms include multiple EM rashes, neurologic effects, of which facial palsy is most common, joint effects, arthritis, usually of large joints like the knee, and also cardiac effects. So how can we prevent Lyme disease? There are three main principles of prevention, and those are personal protection, environmental management, and community interventions. The first step of personal protection is avoiding direct contact with ticks. Try to avoid wooded and brushy areas with high grass, and if you're hiking, try to walk in the center of trails. You can also use insect repellent or repellent-treated clothing. Use repellents that contain about 20 to 30% DEET on exposed skin and clothing for protection that lasts for several hours. Always be sure to follow the instructions on the product. You can also use products that contain permethrin on clothing. Treat clothing and gear, boots, pants, socks, tents, and all that kind of stuff with products containing 0.5% permethrin. And finally, find and remove ticks from your body. Bathe or shower as soon as possible after coming indoors, preferably within 2 hours, to wash off and more easily find ticks that may be crawling on you. And conduct a full body tick check. Use a mirror to see the parts of your body that may be hard to see by yourself. Also examine all of your gear and pets and remove ticks as soon as you can. Tumble dry clothes in a dryer on high heat for 10 minutes to kill ticks on dry clothing after you come indoors. And finally, there's environmental management. Ticks prefer areas with high grass, brush, or debris so that they can be out of the sun. As such, it's important to clear tall grasses and brush from your lawn. Additionally, creating a barrier between your lawn and wooded areas provides an area that makes it difficult for ticks to cross over into your lawn. You can also mow grass frequently, remove any debris from your lawn, and apply pesticides in tick zones. Community interventions are mainly aimed at controlling deer populations, which are major animal reservoirs for the black-legged tick. These involve relocating deer, using contraception, and different ways of reducing the tick burden on the deer. For more information on all of these topics, please see the CDC's Lyme website at cdc.gov/Lyme. Please feel free to leave any comments or questions in the comment section below, and like the video if you enjoyed it. Thanks.